Hi, I'm Mantak Chia, greeting from the Tao Garden, and today we have Dr. George Yu. He's an expert in, now as we say, natural hormone, and he wants to share with you. So here, Dr. George.
Thank you, Mantak. I really appreciate this opportunity to share some information with you. And today we'll present a small but full explanation of some of the reasons why I feel that the Tao practice of 7,000 years may be a contribution to the way we look at modern endocrinology of sex hormones. The passages that I show you here relate to a synergism between a Tao practice, which is quite ancient, but without the scientific basis, and the natural sex hormone replacement endocrinology, which is clearly well known. How did I learn about this? I'm a surgeon, and when I was at Johns Hopkins, I castrated 100 men in 1 year. In that practice for prostate cancer, we noticed within a 1 year time that the men all developed hot flashes. Erectile dysfunction, fat and breast development, anemia, bone mass loss, muscle loss, and diabetes. They eventually had cardiac problems, and I realized at that time that the sex hormones had a lot more to do with other metabolic functions than reproduction. This is what happened to most of them in the 1 year period that you see as a man grows old. He changes from this shape to this shape. They lose the muscle. They have apple belly. They have small breasts, double chin, and shrunken shoulders of muscle loss. This is what we call catabolic. And this is what happens in a lifetime, which happens much longer, but I saw this in 1 year. So what they look like is the typical look of a fat belly, and this belly is not fat. It's actually fat inside the abdominal cavity, and they develop insulin resistance. This is an extreme case of gynecomastia, in which men develop too much estrogen, and you can see that in a young man. You see the fat inside the body is full of fat tissues and no organ. This is somebody who doesn't have it. And this is the modern man looking from this to this. So how did I learn about women? In 1999, I started operating on women doing pelvic cancer surgery, removing their rectum, uterus, and bladder, and had to reconstruct it. In the reconstruction process of the bladder and the vaginal vault, I could not do it without the aid of hormones. At that time, I didn't know much about natural hormones, and I used synthetic hormones, and it worked. So what happened was I became quite famous for that, but I noticed that the women who came to me often did not look like this, but looked like this. They had bat wings of fat, abdominal fat, pads of fat, double chin, and a thyroid-looking leg. Do you see the difference? One is catabolic, one is anabolic. What you usually see is a long lifetime process of change. This is what happens when they don't have hormones. This is a twin who has hormones. So it's very, very obvious that these changes are there. The problem that I see is that what we see is in most animals, they give birth, brain development, survival and adaptation of adrenal stress, and they are then ready to procreate as they approach age 20. But right after that, most animals are really free to die. But because of the technology that's developed of food, heat, shelter, and medicine, people are living 3 times the length of what they were supposed to do. So, what happens? The hormones don't know it. The hormones take a long time to mutate, and it takes about 500 million years to change one hormone. So what we see is a lifetime picture of men and women, and what happens is that the women in their prime time, the progesterone level is 20,000 picograms, whereas the estradiol, estrogen, is 200 to 300. When they reach 40, what happens is that they start losing this progesterone drastically. Their estradiol also decreases, and then it starts increasing a little bit from fat conversion of hormones. So it's this period that all the diseases really start. And the key point is the imbalance that should have been about 100 to 1 to 200 to 1 to less than 1. And we see this very regularly. So in a history, what you see is a woman who has ovaries. She has 2 million immature eggs. By puberty, it's only 400,000. She loses 1,000 on every maturation of the egg. So it is a huge amount of energy depletion and tissue depletion. From age 48 to 55, then there are very few follicles left. So what happens is that there are a lot of things beyond the reproduction. What happens is, at first they develop the hot flashes, and then they have sleep problems. This is one of the biggest things that we see clinically among older women, is that their sleep fragmentation is that they fall asleep, but then wake up, fall asleep, wake up, because they don't have the hormones anymore. The weight gain, the mood swings is very obvious. So it's very common for a man to tell me that their wife has changed, they don't quite understand her, and the moods keep fluctuating. But the women notices the memory change. The multitasking that they were able to do is no longer a common thing. What happens is their skin changes and the thyroid begins to not function. Of course, slowly they develop muscle loss, fat accumulation, and little by little they can see that their vaginal wall, eyes and mouth may become very dry. Therefore, sexual intercourse becomes a very difficult process. Their bladder function is also changed. Many of them start leaking urine, and when they have intercourse, they will leak urine. The libido, of course, is gone, but the bigger problem comes here. Then the breast cancer develops, endometrial cancer for those who never married or had children, and then the heart disease, and lastly, but not least, Alzheimer's brain dysfunction. So in men, it's very clear also. What happens is that they start as a child, they go into their prime, which is about 1,500 picograms, and then it starts declining from age 40 to 60, and guess what? Their estradiol, estrogen, starts climbing up because the fat is making it. So what happens is most people have problems right around age 40 to 60. The question I always ask myself, are there alternative ways or other ways to use and preserve your male gonadal hypothalamic axis? So in a man, 700 million Leydig cells by age 18. By 70, only 250 million remain. The sperm count goes from 200 million and declines with aging, but is persistent. The testosterone declines 2% every year. In fact, there's another funny event now. We see that the grandfather at the same age had more testosterone than the father, and then the grandson has less testosterone at the same age. We don't know what it is, but it could be something related to toxicity and obesity and sleep apnea. So sleep, eating, lifestyle affects them very much. In men, this is a very key summary that you should remember. When you start developing andropause, some of the things occur. Libido goes down, erection goes down. You begin to develop some visceral fat, the pot belly. You begin to lose some muscles and bone. You get shorter. You develop some form of glucose intolerance, and eventually you get diabetes. The clear thing is the muscles all go. The shoulder muscles and the thigh muscles are the clearest indication of atrophy and catabolic changes. Skeletal muscles, but the ligaments also occur because you can see that when you do something vigorous, you have more injuries. Heart muscles are very important. Men lose heart muscles, but women don't, okay? But one of the biggest things that I see in my practice is the mental part, in that men have this great ability to concentrate and look deeply into an issue, and the women can multitask better. They cannot do this, and eventually they start having problems here. The mood changes are what we call grumpy old men, and we see that very, very often. But the more important thing that drove me to look at this more seriously was the fact that they develop diabetes and they have an increased mortality and death. So why are sex hormones so important? Let's go beyond reproduction. Let's look at bone loss. Here is typical normal bone, and this is a typical fracturable bone. It's very porous, and it's well documented. What most people don't understand is they don't realize that the heart muscle has huge testosterone and androgen receptors. This is a classic work done by McGill. He's one of the greatest endocrinologist researchers in the world. And this is a classic paper which shows that male and female, by the way, this heart muscle was from a female. So it isn't just males that have these receptors, the females have it. So you could see from the study done from the Framingham study that we could see that men's heart muscles decline, whereas a woman is flat. The mass also declines. So maybe that may be one of the reasons why men die earlier. So what are the ways that we can preserve this? I would advise you all to look at some of the layman's books. These are all excellent. I recommend this one and this one first. For the men, I recommend these two as a good start. This is a much more intellectual one, and this is a social one. Very interesting, but you need to understand it. So this is the interesting study that was done, and I published this, but one of the things that we know is that if you take a normal cell, whether it's heart muscle or testicular muscle, the smooth muscle, we see that the mitochondria are the big energy packets. These are what we call the true conversion of mass to pure energy. They develop very well in the female and the male as they are older, but if you castrate a male, the mitochondria become swollen on electron microscopy, and they have these vacuoles of unusable energy. When you give the testosterone back, it can revert right back to normal. So we know that these endocrine hormones have a tremendous effect on how energy is converted from mass and reversed. So the question I had was in 1978 when I castrated 100 men at Johns Hopkins as part of a study of prostate cancer, and we saw this as a rapid andropause. What happens naturally is very slow, so what your doctor will tell you is you're just getting older. And when you look in the mirror, you look older. So this is natural, but it isn't natural. It is a true mitochondrial function deterioration, partly because of no testosterone. I published this in 2011, 33 years later. So this is the clinical one, this is the scientific one. And I asked Mantak once, I said, can these great historical practices make a big difference? And what I admire about Mantak is that he has a very practical approach to something that we as Chinese knew about and practiced in a different way, but did not really understand it deeply because there was no clear practical applications. So the question I raised is this. This is a key slide for you to understand. In life, from 0 to 100, procreation starts around this period. Menopause starts around age 37 on. Cancers and chronic disease start about this time on. And the question I raised to Mantak and the Tao practice was, can you modify this? If you practice this at age 28, can you decrease all these other things and prolong your survival? We know that with proper use of hormone replacements, we can definitely increase the longevity and the well-being of a person. The stem cells are never to be forgotten because it's coming rapidly. And I would say that when the stem cells really become a practice, it will definitely change our lives from 0 to 100. Now, this is an important slide because Mantak and I have been talking about this for a long, long time. In that, let's say we have menopause. Let's say we practice the Tao. If we practice it, can we modify the menopausal progression and the andropausal progression? And can we modify the chronic disease occurrence? That would be a key major input from this practice. And can hormones, of course, may have to come into the picture because you will all, including myself, die. You will age, no matter what. And there's no question that the natural hormones have a lot to do with it in terms of aging, endocrine-wise, and also disease-wise. And likewise, stem cells will change this. So if you look at this conceptually, you can see why this is so important. The hormones are basically an axis passage from the hypothalamus, pituitary, thyroid, pancreas, adrenal gland, and gonads. We know this is a very important signaling hormone, and in the microscopic orbit, we see that Mantak has been preaching. It's clearly related to the conception vessel and the governor vessels, very well known in our Chinese history. Can massage and orgasm activate this process? I believe it does, but I'll let Mantak talk about it later. Can the microcosmic orbit circulation of energy preserve and decrease menstruation cycles that each young woman has to suffer from age 16 on? And can we decrease menstruation and preserve a woman's menopause, breast density, breast cancer, endometriosis, uterine fibroid, uterine cancer, and estrogen-induced hypothyroidism? The difference is now we can measure it. We can measure these hormones as you practice. So during breastfeeding, we know one thing. When the milk production comes out, oxytocin comes out, and we know that massaging the breast will increase the prolactin and decrease the testosterone. It's well known. So it would be fascinating if we could coordinate this and make it a science. Can the Tao practice arrest, shorten, spread out the menstruation by ovarian breathing, breast massage, vaginal jade exercise, the microcosmic orbit of the fusion process? I will let others explain that, but I feel that this is important for us to understand that we might be able to modify a lot of these practices. One of the things that we know for sure is in a cycle for a woman, the progesterone is made by this corpus luteum. Here's the egg that falls out. The ovary makes the estrogen and has to be a perfect synchronized balance or else you have a lot of problems. PMS is nothing but not having enough progesterone. So you could see here the estradiol from day 14 on is around 200 to 300. But you see that the progesterone is 20,000. It's a huge, huge difference. And can you do this 400 times in your lifetime? Probably not. So the rebalancing of hormones, the biggest problem that we see clinically is sleep problems. All these others follow, and one of them is bone loss and even clots. All these things that you see here are the result of an imbalance of hormone. One of the things that we know very easily is that on mammography, which many women have, that shows breast density can be eradicated very quickly a year later by a natural progesterone cream. It's simple. Can the endometrium of the uterus be in good shape if you practice the vaginal contraction? Can a woman avoid uterine cancer and endometrial thickening by these practices? One of the things that Mantak talked about, and we know very well classically, is the Voorhees study, Nature 1992, in which the nematode, which was not mated, lived much longer. As you can see, these open boxes show a longevity which is pronounced. Therefore, sex hormone and the sex production of sperm may have an effect on longevity. In men, we clearly see that as in aging, we see a loss of the hormone. In fact, we see a transgeneral, grandfather, father, and son, showing an even lower hormone level. Why accelerated decline in hormones? One of them is sleep apnea. The other one's diabetes, people who take opioids, chronic disease. Astronauts lose it very quickly because there's no gravity, toxic chemicals. So I just want to show you an interesting slide that you'll never forget, is that if we take away testosterone, your penis will develop fat inside. Okay, you see that? And this is electron microscopy, and this shows you that the energy that comes in has to have a signal. If it doesn't have a signal, it becomes fat. The same comes in the 100 men that we castrated, a mitochondrial dysfunction because of no testosterone. And so the mass is converted to energy. Mitochondrial use of glucose and pyruvate creates ATP. Everybody knows that these guys make ATP. If you don't have ATP, you die. And if you didn't have testosterone, it makes these ATP machines not work. Okay? So, can Mantak and the Tao change erectile dysfunction, prostate enlargement, metabolic syndrome, diabetes, prostate cancer, sarcopenia, and earlier death? We can measure these things for you. So can this diagram, which shows multiple orgasms without ejaculation, really preserve you? And this is a 7,000-year-old history of a practice in which they say that men of age 20, the interval between ejaculations 4 days, to the men at 60, which is me, should be past 30 days, and it may have the validity of preserving the energy that you need to prolong your life. So one of the things that we see is the prostate massaging that's been advocated. Some people have short fingers, and some people use this practice. And can that avoid the prostate enlargement? Can the contractions do the same in moving the energy up to the head? I would let Mantak talk about this more.